Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. I'm specialized in minimal invasive procedure, and I have personal technique that from here to here I do not remove the skin. I perform endobrow lift, I perform blepharoplasty without skin resection, and periorbital rejuvenation, also without skin resection. This is my curriculum. Today I'm going to talk about facelift with hyaluronic fillers. This patient lives in California, and he came with his wife to perform a non-invasive procedure. If we see here, this patient performing United States blepharoplasty, or conventional blepharoplasty, but you can see the flaccidity, the wrinkles, the malar festoons, and we talk about in 1 year he's going to come to Buenos Aires to perform an endobrow forehead lift and also tightening the skin with carbon dioxide laser. But now he come to Argentina to perform no invasive facial rejuvenation. If we begin from here, we can see this malar festoon, these wrinkles, but I can do carbon dioxide laser because take a time of recovery. But also in this area, this patient lack of volume in the malar area, and the volume in the malar area is very important in the aesthetic and also in the facial balance. If you look, I invite you to look for nice, very beautiful girls, very beautiful men, and what is a nice face? A nice face is the face that have malar volume, and also the continuation of the eyelid in the malar is also almost imperceptible. But this patient look also tired, but have a darkness here, dark circles, and I'm sure I'm going to improve this with the voluminization of the malar. And in this you can see a deep nasolabial sulcus and also this depression under the lower lip, and here we can see this depression. Also, this patient have a facial ptosis that need also a facelift, but this is taking time, and he's going to come next year just with the adequate preparation and time. How I can improve this patient to look in a way younger? That then I begin to work in the malar area, voluminization of the navel sulcus, voluminization of this area, but also voluminization near to the chin, between the chin and this fold. If I spume, blur this area, I can produce just almost a facelift just with fillers. Here we can see the wrinkles, the lack of volume, the tear through. You can see the tear through, also the tear through. Again, this area, the facial ptosis, the deep sulcus. Here we can see the medical doctor that performed lower eyelid left this upper fat pad that generally the medical doctor that not very well training, many of them left this lower eyelid fat pad. Here we can see the tear through and the lack of volume and the difference between the chin and the lower eyelid. My idea is just not only improve with the filler the malar area, the cheek area, just to shorten in the lower eyelid to look younger, and also esfumate, blurring this fat pad. Here we can see, and in this view you can see much better the lack of volume, the lower lid fat pads, and also the facial ptosis. And this is after the procedure. We can see clearly how improved the malar, the lower eyelid is shortened. Here the lower eyelid cheek junction is here, very long distance, but now is here the lower eyelid reduced a lot, and a lower distance of the eyelid is youth. And when the lower eyelid cheek junction is very low, is old. When the lower eyelid cheek junction is high, is youth. Here also you can see how improved the deep nasolabial sulcus, the depression here, and also I think I made just a facelift because this is hanging, and here we cannot see hanging because I fill all this area and also outside the chin. Then with this filler I perform almost a facelift. You can compare this with this one. You can see how improved the lower eyelid, the malar area, the cheek area, how I reduce this distance, and I think this is almost like a facelift with no invasive 20 minutes of procedure. You can see the lower eyelid external fat pad, and here I esfumate with a filler because I increase this, the malar area, and this one to get this result. And this is almost facelift. Here you can see how nice is the cheek, how nice is now the lower eyelid, and the facelift getting just with fillers. It's clear. The facial skin is hanging here, like here, but like I perform filler here, don't look like. This patient now look like a facelift, and this is impressive. The chin, you can see the tear through, you can see how nice is the cheek, just like a young patient, because when we get elder, we lost volume here.
¿De dónde venís?
De California.
Bien. ¿Te gustó lo que se hizo?
Perfecto, un cambio tremendo, un cambio tremendo. Muy lindo, muy profesional.
The patient is happy, look younger, just immediately can go on with his normal life. He and his wife is taking a plane today after the procedure. Okay, I hope you enjoyed this presentation.